Okay, Mr. Max, this is Dr. Wong. We're just getting started in your shoulder. Let me kind of give you a tour. Right now I'm in the back side of your shoulder looking towards the front. This instrument is coming in from the front. It's called a probe, and it is 5 millimeters from the tip to the back of that elbow. So everything here is very magnified. This side of the joint over here is the ball side of the joint. It's spherical, as you can see, and this is perfectly good-looking cartilage. And there's a little bit of cartilage damage right here. You see that softening right there. So we'll have to investigate that. Looks like you impacted it at one point. But the vast majority of the cartilage is perfect. Remember, again, this probe is 5 millimeters, so this is probably only like 2 or 3 millimeters in size. The cartilage on the other side of the joint is the socket side. We call that the glenoid. So this is, of course, very nice-looking cartilage. Maybe a little bit of fraying down here, as you can tell there. So we'll get all that cleaned up for you. We're, of course, here because of the labrum. So the labrum is this structure that sits on the edge of the socket. So where the cartilage ends here, then there's this extra tissue here called the labrum, and it goes around pretty much circumferentially around the socket. At the lowest part, it looks very intact. You can see how nice and seamless it is down there. And as it comes upward here, you can see there's the beginning of the tear here. And in particular, it is torn up here. You can see this area here. So this is the problem, we think, because this is right where the biceps attaches. So if I follow this tissue right here, this is actually the long head of the biceps right here. Got some tissue in the way. Let me try to get you a better view. So there's the biceps tendon coming in from outside of the joint. You can see a little partial tear right here, and then this is its attachment right here. So this is truly a biceps anchor tear. So that's why we're going to do the biceps tenodesis. So we're going to release it here and then reattach it down low for you. That will eliminate the pull on the labrum, and then we have to clean up the labrum tissue and sew it or reattach it back to the edge of the socket. Now, the other structures here in the shoulder are the rotator cuff tendons. There's one way in the front underneath this device, which is normal, and then there's beautiful rotator cuff tendons over here on the other side of that bicep. So these tissue structures here, right here, going all the way to the back, those are the rest of the rotator cuff tendons, which look amazing. So right now we think we have the identity of your source of pain. That's going to be your biceps with the labral tear. We're going to get going on fixing it.